Welcome back. Well, the rising statistics of those who've died from coronavirus in the U.S. can be a little misleading out there. The CDC released a report in September that shows an overwhelming majority of people who wore masks actually tested positive for COVID-19. The report was conducted back in July with 154 case patients who tested positive for the virus and a control group of 160 patients who were symptomatic but tested negative for the virus. All patients were from the same healthcare facility, and 70% of those who felt ill were the ones who always wore masks. Plus, more than 70% of the case patients participated who all tested positive said that they followed the CDC social distancing guidelines and regulations when they were out and about, but somehow they still managed to get the virus. The CDC report concludes it's not clear if they contracted the virus from the times when they removed their masks to eat or drink, or claim, quote, characterization of community exposures can be difficult to address when widespread transmission is occurring, especially from asymptomatic persons with interconnected communities. So, now regardless of this new report, Dr. Fauci and many other politicians are still encouraging Americans to wear masks all the time. They say that it will slow the spread, and yet they forget to tell us the exact number of those who've died with the virus or died from the virus. And also, they don't point out those numbers about who was wearing a mask that got it and then died and who wasn't. I wonder why. All right, to speak on these new findings from the CDC, joining me now, urgent care physician Brian Tyson from Southern California. He's been on the show before. Hey, Doc, how are you, sir?
Good. Thanks, Dan, for having me back. Appreciate
All right. We welcome you back because I want to get this out there for folks because I read these two different reports. The one was on the comorbidity rate, and the other was on the rate on masks. And I believe you and I touched on this a week or two ago when you were on the show, and I asked specifically because, of course, the mainstream media buries these numbers and buries the facts. And I recall the CDC head, when he was under oath, saying that the number, because I love how CNN has that horrible graphic up every single day reminding Americans, scaring Americans, fear-mongering Americans, 210 dead, 212 dead, 217 dead, that all these numbers are including dying from COVID and dying with COVID. Could you please explain to folks the difference? Because the number of whatever it is today on CNN's little ticker is not accurate. This is not 217,000 Americans died because they got COVID and it just killed them and they were healthy people. So explain the difference between died with and died from, and then we'll get into the co-mobility rate and the mask wearing.
Yeah, you're absolutely 100% correct. When we looked at the numbers of COVID cases, okay, and the mortality rate from that, they're reporting about 217,000. When you look at the comorbidities and you look at 131,000 of those patients died with what we call end-stage chronic diseases. That includes chronic lung disease, heart failure, heart attacks, cardiac arrest, strokes, cancer, and end-stage renal failure.
Hold on, let me jump in real quick. I got to point this out to people. Okay, so you just said 130-some thousand out of the 217. So that would leave about 67,000, which, by the way, is what, about the average of the flu. They had a chronic or some debilitating disease, something wrong with them, that the flu or another virus or disease could have killed them if they contracted it because they were already sick.
That is correct. And again, these are end-stage diseases that we're looking at. End-stage diseases, okay? Now, you look at the rest of this picture, and one of the striking statistics that came out was 84,000 patients had a diagnosis of influenza and pneumonia along with COVID-19. So they including the influenza death rate into the COVID-19 death rate.
Aha, there we go. And we know that the average every year is somewhere between 50 and 65,000 flu deaths. So those numbers are now getting put onto and into this 217 number of COVID deaths. So if we subtract the influenza ones and subtract the other ones that died with versus from, which is the one that blows me away, because you could literally be asymptomatic but have COVID, right? And
That's correct.
And then die of a heart attack. But when they take your blood and find out you have COVID, then on the death certificate they write died with COVID. It didn't kill them, the heart attack did, but the CDC puts that up there on the board, and so does CNN, and that's another COVID death, correct?
That is correct.
Which it's not.
And
I just want to point that out. So, it's not. COVID did not kill them. Something else did, but we're getting this massive, huge number that the left loves to blame then President Trump, saying he's responsible for 217,000 deaths. But that's not even the accurate number.
That is not, I mean, it's absolutely inflated. And one of the other things to look at too is look at the place of death, okay? They've actually divided this out. And 65,000 of these cases died outside of the hospital, which we would say died of natural causes. So they were even looking at natural causes as a cause of death.
Wow. Okay, I've got another question I got to throw out there about the story I ran right before you came on, Brian, and that's the masks. I'm not going to say or speculate whether you should or shouldn't be wearing them. But now this new report that I just read before you came on says that folks that died or just had it and recovered were wearing masks, were following all the guidelines, were staying locked down at home, and they still got the damn virus. You're a ER doctor, you're seeing this stuff every day, frontline, urgent care, they're coming in. What's your advice on masks? And with the new findings about the masks, what say you? I'm going to keep my mouth shut.
Yeah, so there's three different masks that we really need to address. There's the cloth mask, there's the surgical mask, and then there's an N95. So the cloth mask that everybody's mandated to wear is not effective at all. Okay, let me repeat that. It is not effective at all. And in also what that does is also gives people a false sense of security. If you're wandering around with a mask that does not protect you and you think you're protected, your behaviors have changed. And we notice this in public all the time. Patients aren't washing their hands as much as they would. They're not going about their business and staying away from people. They're going into crowded places. They're doing all the things that they shouldn't be doing that would normally keep them safe because of that false sense of security. Surgical masks do protect others if you're sick, and N95s do protect the medical health professional who is taking care of these cases. Those are the masks that we use. Those are the only masks that will prevent you from getting sick.
All right, Dr. Brian Tyson from All Valley Urgent Care in Southern California. We appreciate your insight, you breaking down what these new findings show, and just spitting out truth, fact, and the science of it, because we are getting so much convoluted, pardon me, BS from the media and from politicians playing with our lives, playing politics, that we never hear the real truth. So, Doc, you're always welcome on. Brian Tyson, again, thank you for joining Real America tonight.
Thank you. Appreciate it.
Straight ahead, California was one of the first states to mandate a coronavirus lockdown back in March and still has many restrictions that are in place, causing millions to continue to apply for financial aid, but their unemployment system is a wreck. We're going to speak with a Republican state senator from the Golden State who's trying to fix the system. Don't go away.